Hi, today we are going to see the test taking strategies. So, yesterday I have given a small introduction regarding the prometric examinations with the DHA, HAAD and with the MOH. So, the test taking strategies. So, with the test plan and with the strategies they will be following to take a questions. Even we have to follow as a students when you are getting into the examination to answer the questions. We need to follow some strategies. So the main strategy is your critical thinking, your creativity, ability, and your problem solving and your decision making skills. So these three skills are basic things that you need to get well developed within yourself, even with your previous experiences and with your previous theoretical knowledges. You have to be well developed with these skills. Only then you can be able to answer the questions. Don't think that this is like a theory based. So when they ask a question at one day, if you get any one example, an example and with one question means the same questions will be with the same answer. You don't think that the same questions will have the same answer on the another examination or any other part of practices. So that will be getting differing according to the way they are asking and according to that words they are using there. So that will be differing. So even we are going to see the some of the more points related with that. And before that I am going to ask you one of the question. I am going to show you an example. One of the example is given here. Signs and symptoms of post-thyroidectomy respiratory obstructions they have asked you with the degree of severity. So here with that symptoms, with that respiratory obstruction which happens after the post-thyroidectomy, what would be the early signs and symptoms? Which would be the early signs and symptoms they have asked you, and which you can expect here as an early signs and symptoms with this respiratory distress? You can select the answers which are all appropriate to this question. So this is one of the example with a multiple response type of question. So select all that apply they have given at last. So you can go with options which are all would be the correct one. You can pick those answers and you can say here. You can give an answers here. So the first option they have given hoarseness of voice. Second option stridor. Third option difficulty in swallowing. Fourth option cyanosis. Fifth option is a choking sensation. Which would be the early signs and symptoms? Immediately, once the respiratory obstruction starts, so how the patient will feel, how the patient will show the symptoms, what you can see. So that is the thing we need to answer here. That is a early, not with a later. That is a early symptoms. Suddenly when the obstruction starts, what the person will feel at that point. So the correct answer, you may be thinking, so please keep it in your mind. So always you have to go with the proper words which are being given in the questions. You have to look for it. The second line which is been showing here in the question is the which early symptoms. You have to note it down, the early symptoms, early signs and symptoms. That is the very key point that you have to notice in your question. And answer here is the appropriate answer here is the difficulty in swallowing and choking sensation. You may be asking why the hoarseness of voice will not be there, why the stridor will not be there, why the cyanosis will be there. But these are all the coming as a later symptoms only. The hoarseness of voice will be as a secondary stage only with the respiratory obstructions you can have. And even the stridor, cyanosis also will be seen only in the later stages of the obstructions the patient will have. So the initial with the early symptoms, immediately after the obstruction starts up, the patient will have difficulty in swallowing. Whenever if they want to swallow even a saliva also, they will not able to swallow it, like dysphagia feeling, more obstructed feeling in their throat, like swallowing difficulty. That is the initial thing they will be having. Even they will be having choking sensations also. Something is been obstructing, something is been on the way of their throat, so they will not able to swallow. That is the initial thing they will be having. So with that only the respiratory obstruction starts as an earlier. So that is the correct answer. So like this way there are many questions we are going to discuss in this channel. So regarding the DHA, HAAD and with the MOH, even with the NCLEX also. So the general test taking rules are there. So whenever you are the test taking strategies, whichever you are been following in answering, so we need to identify the topic related with that questions and what topic it is there, it is been asked. And next, the one of the strategy you can use here while you are answering the questions, you can go with the eliminating choices techniques you can follow whenever you are answering the questions. Like if they have given 4 options or 5 options, as a direct multiple choice, sometimes they can ask you like a 4, they can give you 3 options as a wrong and 1 they can give as a correct answer. So by eliminating the unwanted options from that question, and finally you can get into the correct options which would be the appropriate to that question. So that is also another one way of eliminating choices techniques. And always do not go into the background information unnecessarily. You no need to think of it. So the appropriate the question you have to think of it. So the words they have given, the what conditions they have given, the what situations they have given for you. So the regarding that alone you have to think of it, and because don't waste your time on thinking with the unnecessary informations. Do not read into the questions also more than twice. That's my kind advice always. So whenever you are reading again and again and again, so in the first point you will be leaving some few points from that question. You may be leaving that as you read it. As you hurry up and you are been reading into the questions, the first time you will not get cleared with that question. The second time you will be getting cleared. When even after you are getting cleared with that question, what is the meaning of it, and you, even though again if you are reading again and again, you may be getting confused with that questions. So you may be thinking that that would be like coming out of some other point. You may be getting some other informations also in your mind, and you will be getting confused with that. So don't get more confusions into reading the question answers again and again. So don't go into the reading the questions more than twice. So that's a kind advice. So next is the eliminating choices techniques. So that is once the choice has been eliminated, don't go back into it. So as an eliminating options, you can eliminate the wrong answers first, then you can get the one option as a correct one. That is a very good technique you can follow. But some questions they can ask you as a priority. So I will be discussing all those things later. But here we are seeing only the eliminating choices technique. So that few questions may be that may be apt with this type of eliminating choices way you can use with some questions, like direct questions they can ask you. So they can give you one option as a correct and other 3 as a wrong option. So you need to look into that options correct one. And with the assessment and interventions basis also, they can ask you like if there is any assessment based questions with the intervention based questions. So like what you will be assessing with the patients, like assessment with the subjective and objective data, you have to assess them. And with the interventions, when you are making a plan according to their complaint, you will be planning for them. So how to take care of them. So that you have to do both the things. They can ask you as a question separately with assessment, separately with an intervention separately. But whenever you are going into that, please go through the Maslow's hierarchy model, and you have to make an answer based upon that Maslow's hierarchy model only. So that is a priority based. How to make a priority. Which option, which need you have to make a prioritizing, and which need you have to analyze with the patients, and which you have to intervene them. Which need you have to first intervene them. So that is a very important point that you have to do it first with the Maslow's hierarchy model. That is also very important one point that I will be discussing later with you regarding those Maslow's hierarchy model. So the basic thing what you have to differentiate with the Maslow's hierarchy model is the psychosocial need and with the physiological need. So the basic thing what they are telling with the Maslow's hierarchy model is that physiological need has to be given as a first priority. After that only you can go with the psychosocial and psychological, all those social related needs will be coming as back of the physiological needs only. So don't go into the psychosocial needs, like example pain. One patient will complain pain, another patient is getting with a respiratory obstruction, he is not getting a proper oxygenation. So for whom you can show the first priority to make a intervention means you have to go with the respiratory cases only, with the dyspnea cases only, who is getting breathing difficulty, not with the pain. With the secondary option only, you have to go with the pain case to manage them. So like this way, we need to make a priority wise and we need to intervene them. So this is the basic things. This is the basic priority wise they can ask you in a many questions. Maximum number of questions in your prometric exams they can ask you based upon these prioritizing character. Like a psychosocial and with the physiological needs, we need to eliminate always with the psychosocial choices, always go with the priority with the physical needs. So that's the main concept. As an introduction with the Maslow's hierarchy model, I have told you today with this video. So please subscribe to my channel. You will be getting more and more of videos related with this prometric exam preparations with the many points related with the preparations and with the different types of questions and with the subjects and with the theories and different practice questions I am going to discuss so in this channel. So please subscribe to it so you can able to get notified with each and every videos when I am posting every day. So all the best for your preparations. Do well your examination. Crack your prometric examination. Thank you.